I'm a fourth-year medical student from Lincoln Memorial University down in Harrogate, Tennessee. And I'll be presenting on the impact of COVID-19 pandemic on patients with acute cholecystitis and their financial implications. So we all know that coronavirus started in Wuhan, China in 2019, and by January 2020, World Health Organization declared a global emergency of COVID-19 pandemic. And the pandemic, affected a lot of different industries throughout nationally and internationally. The healthcare industry took a pretty big hit where we were lacking personal protective equipment, ventilators. We didn't have ICU beds. We didn't have medical staff to take care of our patients. And because of these lack of resources, hospitals had to delay or even cancel some elective procedures, whether it's endoscopies, general surgeries such as cholecystectomies or even orthopedic surgeries, et cetera. And in addition to that, because of the quarantine, we also had our citizens lack employment, and that affected our financial situation of the country and for the patients as well. And so with this study, we aim to kind of understand the implications of the pandemic on patients, especially patients who were diagnosed with acute cholecystitis. We just used this cholecystectomies as an example of the elective surgical procedures, and kind of understand the financial implications on those patients, especially at the Murray Regional Medical Center, which is the hospital where I do my rotations at, and it is down in Columbia, Tennessee. It's a community hospital down there. And so in order to gather the data, we collaborated with the billing and coding department of the hospital, and we obtained the following data. So the number of total admitting patients from the years of 2019 to 2021, the number of acute cholecystitis cases, the total number of inpatient days, the average length of stay for those patients, and the direct cost of the surgery and the hospital stay itself for those patients. And then we ran some analysis, and as you can see, there are different graphs there indicating the data, but all of this data, the number of acute cholecystitis cases and their direct cost and their length of stay was compared with the total number of inpatient and their length of stay and direct cost. And so from this data, we can tell that there is a gradual increase in all these parameters from 2019 to 2021. The first graph on the left side, those are the number of acute cholecystitis cases, and you can see that there's a gradual increase. And there's a similar pattern in all these graphs. But what we realized is that the greatest increase was observed in the direct cost per case and the average length of hospital stay for these patients who were diagnosed with acute cholecystitis and underwent laparoscopic cholecystectomies, which is an interesting data. And it kind of supports the whole idea that, the pandemic did have a financial impact on the patients, especially in the healthcare industry, because we're lacking the personal protective equipment, and the supply chain demand was taking a hit. So that is our conclusion. But, even though we have this amazing data, we do have some limitations. From 3 years is a short period of time to obtain data and see a trend. So we hope to pursue further studies by obtaining data from years of 2017, 2018, and also 2022. So just kind of comparing the pre and the post COVID-19 pandemic era and just following the trend in the number of those cases and the average cost for those patients. And also, we have a limited data because this data is only from one small community hospital in the state of Tennessee, so it will be interesting to compare this data to different hospitals across the state or even the country, and maybe comparing this to a national data bank if there is one, and just to see how if there are any geographical implications, to this data. So those are some of our future implications, future studies that we hope to pursue. But I do want to thank our billing and coding department at the hospital, because without them, I wouldn't have been able to obtain this data to pursue this study. Yeah, any questions?
What difference do you expect to see in length of stay from, I guess, pre-COVID to COVID times for cholecystectomies?
Here we can see that there is a gradual increase, and I do believe that because of the chance of becoming infected with COVID, while if you're, having an overnight stay post-procedure, you have a higher chance of becoming infected COVID. So the average length of stay might increase due to those complications.
Thank you.
Yeah, thank you.